Okay, it's been 7 months, 2 weeks since my gender confirming surgery. And since my last video, what I talked about, I seen the doctor at the beginning of the month for my follow-up and how the issues I was having with like the bleeding, the vaginal bleeding, the stinging, burning, itching, and felt like I've been kicked in the testicles. I don't have any. Well, what happened was everything healed. He's saying that everything looked good. It seemed like my body, there's something going on. Knew what was happening and fixed it. My body just fixed itself. And he was saying that the part where I felt like I've been kicked in the testicles was the spermicidal cord. Spermacetic cord. He's saying that sometimes the body tries to regrow some of it, or if there was scar tissue buildup and it got stretched out or pulled, that could cause that. And if I continue to have that issue or feel it, then I need to talk to the urologist. And if it ended up continuing to happen, then I'd probably have to have surgery to fix it. But thankfully it stopped. But this morning I noticed I was bleeding again. It may be due to dilation because I was doing extra long just to help relax and loosen everything up in the very back of my vaginal canal, the end of it, because that little spot's still a little tight. And when I was asking him about how long I have to dilate, he was saying that there's no exact schedule for dilating, but they recommended the way I'm doing it, like twice a day for 30 minutes. And he was saying I'll be dilating like pretty much life, like for life. But I could go down to once a day. But because I'm having that tightness still, I decided to continue twice a day for a year, because he recommends at least a year dilating twice a day before changing, which it's helping to loosen that back part of the vaginal canal, which is still really tight. And he asked me again if I wanted about revision surgery, which at the time I still wasn't quite sure because I was wanting my body to heal a little bit more. But the way I feel now is I'm leaning towards having it done so in the future I don't have any issues that cause dysphoria. Because what needs to be done is my labia minora, the inner labia, how it's, when everything's healed, how it wrinkled down. He wants to lift that back up so it's the normal labia minora, like the length of it, so it's lifted and flattened back to normal. And since my labia majora isn't filled in, because before he was saying, because I don't have a lot of fat on my body, so it's not like filled in like it should, and they just have to do fat transfer from my body one part to another. But because I didn't have a lot of fat on my body at that time, I wasn't quite sure how to go about that. But since gaining weight, I do have a little more fat on my body that can be used. So I'm decided now I want to have the revision done to fix these issues so I don't get dysphoria later on. And with the asymmetry I have with the labia minora, I'm happy if it gets left that way. But if it gets fixed, I'd have to get used to that. But I'm okay with it, the asymmetry being left, as long as the labia minora gets lifted and the labia majora gets filled in. And when they weighed me right before my appointment, like they usually do, I weigh it was 130.2, which I was happy about that because I've reached my goal of 130 pounds to help with my transition in my body, especially with the fullness of my breasts, so I don't have issues like with dysphoria or clothing fitting. And how I've been saying I'm a cup size bigger since surgery, it's still true, but my breasts are much fuller, and I'm still having the issue I usually do when my breasts go up a cup size, because I'm bottom heavy. Like my breasts are bottom heavy, so the bottom half of it usually fills in before the top half. So the bras in my size, the tops of it doesn't fit right, but the bottoms fit perfectly. So I just have that weird issue with trying to find bras that fit right because of it. So currently I am a 32G American sizing on the small end of it. And this bra I'm currently wearing is 32 triple DF. And what's been happening is my bras don't fit right. The bottom's down here, because going up a size like that, it ends up folding on itself. Some bras I have are worse than others, and because how tight it is in the cups now, it's just, I noticed a little harder time breathing a little bit. I notice it more after I take off the bra that I'm able to breathe better. So yeah, but I've ordered some new ones where I could find in my size. Because trying to find my size in stores is really difficult. So see how that works and whatnot. So these have filled in since my surgery, since gender confirming surgery down there with the hormone difference, which I'm really happy about that because less dysphoria, and it feels right for my body to have 32G cup sized breasts. Yeah, 32G size. It feels right for my body. I don't necessarily want to be bigger. That would be an H, not want to be an H in my band size. I'm perfectly comfortable at a full 32G, just waiting for the rest of the tops through here to fill in where it needs it. But other than that, I've noticed I'm still losing leg hair very slowly. Because at the beginning of my transition, when I've mentioned, when you look at your legs where the follicle is, where the hair is, if it looks like a black dot or like it's filled in, then you squish it like a blackhead and a little black piece of hair comes out. Yeah, I found 2 of them that did that the other day. So because that's what happened when I first was on hormones and I lost a lot of leg hair. I was doing that, so yeah. So I'm still losing leg hair slowly. I've noticed my butt is actually filled in and much bigger, which clothing fits so much nicer now than what it used to because of that. And other thing is my measurements have just slightly changed when I measured last. My waist was 29 and a half, and my bust was 39 and a half. My hips were 35 and a half ish. So, yeah. And since surgery, my mental state, we're just in the last month, since my last update video, last month or so, a month and a week, but it's just, I have less dysphoria the more my body is changing with the hormone difference. And I just feel really happy with my body the way it is. And that's one thing I didn't think would really happen when I started my transition and having surgery. I never thought I would be happy to have gained weight and have more weight on my body and have my body the way it is now, with bigger breasts, more weight on my body. I never thought I'd be actually happy where it's at, and I have less dysphoria because of it. Other than that, I haven't really noticed any other significant changes with my body since surgery, besides my breasts and my butt and the weight and still losing leg hair. There hasn't been any other real significant changes. And what facial hair I have left hasn't changed. The growth rate's still the same. The amount of hair is still the same. So I just have to get this lasered, because it's not going to ever go away without having laser or electrolysis. And it was just recommended I get laser first after surgery when able to, which I'm able to now, which I've been for a while, just haven't made that appointment yet. But get the laser done through here and through here and through here. Right here is the hair that bugs me the most, is this one. And there's a hair right through here that also bugs me the most. Because trying to shave the one that's right here sometimes is difficult, and this one sometimes gets a sore on it from shaving. So need to get that done. And once I get everything cleared that can be with laser, then I would have to move to electrolysis afterwards. So yeah, so it's just for those who are just starting their transition or needing more information on if surgery affects hair. It doesn't affect, like, once you have gender confirming surgery, or at least an orchiectomy, it does not affect the facial hair in terms of getting rid of it. It may slow down the growth, but it doesn't fully get rid of it. So I've just been shaving every day to every couple of days, depending. Because sometimes, like, hormone fluctuation can make it grow a little bit slower or a little bit quicker, depending on where the hormone cycle is of the month. And which brings up another thing that came to mind is I'm still having the cramps and bloating every month since it started happening again after surgery. And it's just like, it just feels like any other like cisgender woman out there would have it. Even as a trans woman, it happens like the same way. And it's just, for me, when I've noticed this and that happens, it feels normal to me, it feels right. And the mind-body connection is a lot stronger with everything, with my hormone cycle, cramps, bloating, where my weight is, where my breasts are at, and everything related. It's just that mind-body connection is much stronger than it ever has been in my life. So, yeah. It's been so much stronger. But the only thing that's frustrating right now is how I mentioned down there, I started bleeding again this morning. I noticed blood. It wasn't a small amount, but it was a significant amount of blood. So I have to keep an eye on that. And if with the next few days or so, if it gets worse and doesn't get better, then I have to let the doctor know, the surgeon, and figure out a plan to fix things. So I was able to get an appointment scheduled for a follow-up. I was wanting a 9-month follow-up, but due to what was available, because it's March, and there was appointment in April or August. And I'm like, August is clear out there. That'll be like a full year. I don't want to wait 6 months or like 5 months since my last appointment to make it a year. That just would be way too long to get the appointment I need to talk about revision and get that going. Because I want to get the revision done as soon as possible, because the sooner I get it done, the sooner my body can heal, which I contacted them and they're saying what little information I have, I'll be put out for it, and it's an outpatient procedure. So, and from my understanding from what needs to be done, the healing is about a week or so, depending. So yeah, so I was able to get an appointment. It's scheduled for next week. Not this Friday, but next week on the 8th. So we'll talk to them then about what's going on, because I want to reevaluate and talk to them about my goals and expectations for revision and go from there, because I'm at that point where, with having Asperger's, like that autism, sometimes like I get certain thoughts stuck on my mind, and sometimes if it's very specific, it can cause dysphoria. So I've been just thinking about more so with my labia majora being filled in. I know if that doesn't get filled in to where I need it for my body and how I feel, it's going to cause dysphoria later on. And if that's all that's done, I'd be happy. And if the asymmetry with the labia minora stays, I'll be okay with that. But they just need to be lifted up, because that might start causing dysphoria from the way it looks. Because he was saying when everything's together, like when my legs are closer together, how the vulva's more closed together and it looks good. But it's when everything's spread apart, or my legs are spread apart, is where the issue is, where the labia minora is like wrinkled down. In the labia majora, you don't really see anything in my legs are like spread apart far enough. It's like there's no, just looks like there's no labia majora. And that's what's kind of getting to me a little bit. But when everything's like together, when my legs are together, I'm okay with it. So I'd just rather get it all fixed, have the revision, and go from there. So yeah, that's just my thoughts and feelings right now with it. Because the reason why I waited this long to decide to have the revision done was because I wanted it to heal further and heal more, so I can see where everything's at. And even though some of the labia majora has filled in, it's not enough to make a difference. And the labia minora is not going to fix itself. So yeah, so there's like the three things that I know will have to be done. The asymmetry, if we decide to fix that left side and lengthen it down to the perineum, but lifting it up 100% yes. And my labia majora, filling that in with the fat transfer, definitely I feel that needs to be done more than the rest of it. So yeah, but other than that, I'm still happy with the results. I don't regret anything one bit of anything that's happened so far with my transition and up to now. And the thing I've been noticing the most with the last week or so, every time I've been dilating, I've been noticing my vaginal canal is really, really sensitive. It has more sensitivity and more feeling in it all around. Even when I didn't realize how sensitive it was until my last follow-up appointment. That was at the beginning of the month when the doctor, it was Dr. Goodwin, when he was checking everything out to make sure the vaginal canal was good. When he was using his finger to examine it, I felt everything. It was really, really sensitive and tons of feeling. And it was just more than what I thought I had. I didn't expect I would have this much sensitivity and feeling. And this last week or so, I've been noticing it's even more than what I've been having. So whenever I'm massaging that scar tissue that's next to the perineum at the vaginal entrance, that spot is really sensitive. There's a specific spot in between there. It's just like, wow, I didn't even realize this was gonna happen. And I'm really happy that it's more sensitive and functional where it's at, because it makes me really happy, and no dysphoria. So I'm really happy about that, because if I never got the feeling in it, it would cause issues and dysphoria. But since I have that feelings and sensitivity, I don't have dysphoria from it. And all I can say is, I'm not going to go into details, but sexually, it's 1,000 times better. There's actually no amount to how I could explain how much better it is sexually from before hormones and surgery. It just wasn't right, and now it's perfect the way it feels sexually. So yeah, even with the experimentation of using certain things, toy, real thing, whatnot, in there, it's right. It just feels right to me. Where the sensitivity and feeling is, how much, and it doesn't cause dysphoria. And beforehand, before surgery, and before hormones, how there's like, didn't feel anything. In the hormones where I did gain feeling, now surgery, it's even more. Yeah, there's nothing that can compare. So, until my next update video, please comment, rate, and subscribe. And I will do a surgery update video when I get to that point. So until then,